what we're trying to do is eventually put together a videotape that has pieces from all the different
Sure.
interviews we're doing to tell about what the history has been and what it's been like to practice medicine. You all set? All right. Can you start by telling us when and where you went to medical school?
Yes, I went to Tufts
Okay.
Medical School,
And what year did you graduate?
1934.
Okay. And when did you start practicing?
1936.
Okay. Where was your residency?
I had, my hospital training was at Memorial and Providence Lying In Hospital. I went there actually after I'd started practicing. My appointment there was a little bit late, so I left the practice for 6 months and went to Providence.
What was Worcester like then?
Worcester was a very busy city. The industry was flourishing. Norton Company, Heald, American Steel and Wire. Main Street was beautiful, nice stores, nice banks. Mechanics Bank was one I dealt with. And it was a pleasure to walk down there. And pretty soon, Mechanics Bank was swallowed up by Bank Boston. Now Bank Boston is gone. So what are you going to do?
What area of medicine did you practice? You specialize in?
Family practice.
What made you decide to pursue that?
Well, I didn't have too much of a choice. See, and at that time, interns and residents were not paid anything. So if you were waiting 10 years to get married, you better get going or you'd be too old. So I decided not to take any further training. I would have liked to. I don't know just what I probably would have chosen, OBGYN or pediatrics. I decided to do family practice
Where did you practice?
in Holden.
Okay. And what was it like there?
Well, it was rural medicine, pretty much. The census was about 3,500. It's hard to believe because it's not that big now, but it's 15, 16,000 probably. So it's grown. We went to the post office, pick up our mail, and we made house calls day and night. We did have a nice hospital there. It was 20 beds to start with. By the time it closed in 1970, I think it closed, it was 60 beds. And by that time, it had been swallowed up by Hahnemann and Memorial. But the town was, I went to work with Dr. Frank Washburn, who had been practicing there since 1901. And he had a partner who came with him, Dr. Gianno Rice, who had been practicing there since 1918. As soon as World War I was over, he returned from France, and he had started practicing. And then Dr. Washburn, Dr. Washburn believed in having a group practice. They weren't numerous at that time. The Fallon Clinic had started. Dr. Michael Fallon started that. He was a noted surgeon at St. Vincent's, and it wasn't large. Dr. Leahy started his clinic, and he had his first partner was a lady, and she was a graduate of Tufts Medical School. There were only 4 girls in my class. And at that time, Harvard, I don't think was taking any women. but I'm probably a little off at my track now by this time.
That's fine.
That's fine, yeah.
We really just want you just to tell us anything
Yeah.
you want.
Well, I had found out pretty much what medicine had been like over the past almost century, because Dr. Washburn started in 1901. He was a surgeon. He came here because he had tuberculosis, and the Rutland was noted for the Veterans Hospital was up there, 550 beds. The one of the state hospitals, Massachusetts, was there, 350 beds, and there were a few private places in the town. And Dr. Washburn, Dr. Rice had been doing surgery at home until they started the hospital, the Holden District Hospital. It started in a cottage, much like Hahnemann did, and it gradually grew. And they did surgery, they did deliveries, but most of them were at home. And when I came, I saw a lot of their patients. I delivered patients at home, and it was very nice.
Can you describe what a typical workday was like when you first started practicing?
Yes, we made rounds in the morning, and at the hospital, we made house calls as soon as the rounds were over. We then went to the office at what we call the Holden Clinic. There were 3 of us. I was the fourth one to join the group. We had office hours 1 to 5, and Saturdays included. Sundays we had off. Each one of us had a day off, and the others would cover. We worked hard. We made a lot of night calls. We delivered babies at night. We watched our own patients in labor, and we didn't do a big obstetrical practice then, but we did a lot. And I don't think of anything else particularly.
Did you find a lot of time to take off, or did you not have many vacations, or?
We had vacations. We took 3 weeks in the summer, and we were able to do that because we were in a group. Not that other doctors didn't get off that weren't in a group, because they always found somebody. But there weren't that many groups, and even the obstetricians, as I remembered at Memorial, there were no groups when I was there as an intern. But they covered for each other.
Can you describe what Memorial was like when you were an intern there?
I've forgotten how many just how many beds we had. There were 10 interns, residents. There was a resident in surgery and a resident in nose and throat. Otherwise, they were interns. And we just wrote all the history and physicals on the private patients as well as the welfare. And during that time, we were in the midst of a depression, so we had a lot of welfare. The emergency room was interesting because there wasn't really an emergency room as we know it now. Most of the injuries in this area went to Worcester City and St. Vincent at that time, but we got our share at Memorial, but not a great deal. We saw kids with perforated eardrums. We saw kids with bulging eardrums. we had no antibiotics. During the whole time I was, for the first 5 years I was in practice, there were no antibiotics. So we had to deal with it.
What were other typical illnesses at that time?
Well, we used to see a lot of low-bio pneumonia caused by the pneumococcus. And it seemed mostly in adults. The mortality was 50% because we didn't have anything. We took care of them the best we could. We did keep them in the hospital. We kept them in cool rooms. They didn't cough as much. I'll never forget when the antibiotics came. I think it must have been about just before World War II. I think it must have been about 1937. And one of the fellows that was in practice in Barrie came to our hospital. He had had an internship at the Mass General, and one of the residents gave him a few sulfapyridine. And he had a patient next to mine with low-bio pneumonia. They were both admitted the same day, and they were very ill. He gave his patient the sulfapyridine, and I gave mine the usual treatment because I didn't have anything. In the morning, my patient was dead, and his patient, the temperature had dropped from 105 to normal, which was unheard of. And so it went on from there. Penicillin, I don't remember seeing that very much until just about maybe 1940, 41. And it came available just in time for World War II. And at first it was given intramuscularly.
What was it like for your family at the time when you were practicing, working so much?
Well, they were answering the telephone. I had a plug in 2 bathrooms and in the kitchen right by the table, and it was just busy, but we didn't have patients stopping at the house. Many doctors did have their offices in the home, especially up through New Hampshire and Maine. That was very common. Classmates of mine who went to New Hampshire, they all had their offices in the home. And they had advantages and disadvantages, mostly disadvantages.
How did World War II affect your practice?
A lot. Because when they dropped that bomb on Pearl Harbor, the mood in the country changed at once. President Roosevelt had been trying to do what he could to arm the country, but he wasn't very successful. And there was a rush for people who wanted to enlist, and even through the medical profession, most of the medical profession that were needed were over age for the draft. And actually, what they did, they had to curb the number of doctors who were enlisted. And they did it through the Worcester District Medical Society and the Massachusetts Medical Society. In each area, they appointed one person to make a ruling whether that person could go to war. So that's the way it happened. And I did serve in the Army.
Can you talk a little bit about that?
Well, as I said, most of the doctors were enlisting. There wasn't a doctor draft, but you were drafted if you were underage. I was 35 at the time, and I did get a draft notice, but I'd been in the Army already for a year when I got the draft. I was in California serving when I got the draft notice. But I was in 3.5 years, but I was fortunate enough not to land in the trenches. Many of my classmates did. They were battalion surgeons. And if you were doing family practice, you entered as a first lieutenant. If you were a surgeon or had surgical training, you went in as a captain unless professors and associate professors might go in as higher rank.
And after the war, did you come back to your same practice?
Yes.
Had it changed at all?
Well, it was much busy. It hadn't changed a lot, not at first. It finally changed because the town kept growing. It was still small when I came back, and it rapidly grew. But the doctors who were left behind had to work, just about twice as hard, because Dr. Koenig and I left the same day, and that left 3 in our group. And Dr. Washburn was then 73, Dr. Rice was in his 50s, Dr. Crane was young, and he wanted to enlist, and they wouldn't let him because he was a surgeon. And he and Dr. Washburn did the surgery at the Rutland Sanatorium for tuberculosis.
Actually, I was interested in the sanatorium. Do you know much about it and its history? And if you do, can you talk a little bit about that? About the sanatorium in Rutland?
Yes, I know quite a bit about it. It was, I can't give you the date, but it was about 1889 or so. And the reason it was placed in Rutland, now there were other sanatoriums throughout the state, and they were trying, there was a belief that, a strong belief, that fresh air and bed rest they had nothing else to do. I got a little off the track now. What?
Well, when the sanatorium was made,
yeah, the sanatorium. I read the history of Rutland, and there was a man by the name of Mr. Wheeler, and he owned the land where the Rutland State Sand was. It's right in the center of Massachusetts. In fact, there's a tree there that's gone now, but there's a street called Central Tree Street. It's supposed to be the central part of Massachusetts, and the altitude is just 1,200 feet. Anyway, there was a delegate from the Massachusetts House and Senate came there to look at the land. Dr. Wheeler rode up there by horseback from his farm, and they made a deal right there. They offered, I don't know how much it wasn't too much for so many acres. They had a lot of land, enough for a farm. And Mr. Wheeler finally said, this was in October, it was cold, and he said, I'm getting chilly, you have the land at that price, I'm going home. That was the deal.
How long did the sanatorium last?
It lasted until Structomycin came in.
When was that?
That was about it was 19, soon after penicillin. As I remember the story, more or less, and I don't know where it happened, but tuberculosis meningitis was 100% fatal, and without treatment. And they used streptomycin on one of the patients, and it cured him.
Wow. How do you think the perception of doctors was at the time when you were a resident and when you were first practicing? How did the public think about doctors?
Well, I think that they liked doctors.
Has
They
that
really
changed?
did. I don't think so. I think a little bit. And I feel that the doctors that I've come in contact with are just as conscientious as they were 60, 70 years ago.
Good to know.
What do you feel have been the major breakthroughs in medicine since the time you started practicing?
Well, of course, anesthesia and antibiotics, of course. And I think the pay that has been given to residents to keep residents and to develop new specialties wouldn't happen if you didn't have the residents. And it made a difference because the residents weren't paid. The better the hospital, a few of the hospitals paid $25 a month, but they didn't have a good residency.
How about disease prevention? Was that a big topic for physicians? Did they stress
Prevention, yes, it was. The only thing is they didn't understand what cigarettes did to your lungs.
Mm.
At the Rutland State Sand, it's amazing. Here they were treating tuberculosis and they were passing out cigarettes.
Mm.
So,
Can you talk about how did attitudes about cigarettes change and when did they change?
well, that was gradual. Even some doctors refused to pay attention to it at first, quite a few. And I think it was soon after the 1945 or 6 after the war. About every one in the service had cigarettes. They passed them out. They were 5 cents a pack.
Can you describe for us one of your favorite memories about your practice? What did you like best about it?
Well, I liked delivering babies. It was nearly always a happy time.
Mm-hmm.
And there was a lot of satisfaction. And people would never forget it. I developed a fairly good-sized practice for a family practice anyway. And I have people, even now, there was a teacher not too long ago, I didn't even know her name. She said, "You delivered me." But they don't forget. I finally stopped. I delivered babies for about 30 years and then stopped because, number one, I wanted to take the boards in family practice. And you couldn't do everything. You'd be up all night watching a prime up in labor, and then you go to bed at 5 o'clock, and at 6 o'clock the phone would ring, and somebody had a head cold, somebody had a cough, and some emergency. And we quite often pinch hit for some of the medical examiners, Not that they wouldn't come, but it'd take them a while to get there, so the police used to call us, any one of us who they could find, to come to pronounce whoever had been injured or killed or died suddenly. And that happened, still happens, I guess.
Nowadays, it seems like care for one patient is spread out among more providers, not just physicians but nurses. And do you think that is a good thing, or would you prefer it to be?
Well, I think it is a good thing. You get different opinions, but I think it's good to have one person basically in charge.
What were some negative aspects of your practice?
I can't remember many.
That's great. That's really
Can you talk a little bit about access to care? How patients, were all patients who needed care able to receive it? Talk about the financial aspects.
Well, as far as I can talk about our area in Holden, and the same went with most areas, especially during the time of the Depression. People on welfare, for example, at Memorial, the interns delivered most of the patients who came in on service. Of course, we had a backup if things weren't going right. After hollering, it wouldn't take long before we were yelling. And we always had the help. But doctors didn't seem to pay much attention to, whether they're getting paid or not. In many instances, they just didn't. I know one doctor, in West Boylston, he never sent a bill. He preferred to make house calls because he liked to ride in his automobile, and he never bothered to send a bill. But they paid him anyway, one way or another.
How did that change when the government became more involved in medicine?
Well, at first it changed, I think, for the better, because before Medicare came in to being, we were governed more or less by the local welfare. There was a welfare agent, and they were supposed to, the patient was supposed to call them before they could go see us. And that didn't work out too well.
What do you think has changed about medical education?
I think that it's very much better than it was when I was in school. It was good then, but Tufts was an old school. It was formed in the 1800s, but it was not a wealthy school, and most of the faculty, except in the pathology and anatomy, were not paid. They were obstetricians and gynecologists, surgeons that came in and lectured and took us around on rounds.
What was your medical education like? Was it 4 years?
Yes.
4 years. When did you first start seeing patients?
Second year. Physical diagnosis, we started first. And we used to go down to City Hospital. We went to Mass General to see autopsies. We went to the Beth Israel, and their staff was listed on Tufts for a long time, until Harvard found out how good they were.
What brought you out to Worcester?
I was assigned, Tufts had, in the third and fourth year, they sent students all over New England for various things. Pediatrics, I was at Worcester City for a month, and Worcester State for psychiatry, and for general medicine I was at Holden. Dr. Washburn was a preceptor from at Tufts, and I spent 2 months, I think. There was a student there all summer and all in the winter too from Tufts. And so when I was an intern at Memorial, I got a letter one day from Dr. Washburn inviting me to come if I wanted to and join his clinic. The salary was $200 a month. And that looked pretty big to me, because otherwise you had to go out and buy your equipment and hope a patient would show up. So that's the way I started. I can always remember my first house call was a fellow that, patient of Dr. Washburn's, who had an injury, stepped off the bus too quick. Somebody, all he had was a fractured clavicle, but we making house calls. And Dr. Washburn sent me down there to see how he was getting along.
Talk a little bit, how do you feel, this is going back to access to care, how has managed care affected medicine? What are you feeling on that?
Well, I think it's affected. I think when you send a patient at the emergency room and they're sent home, when you think they should be, you know what's behind it. It's managed care. It's some insurance company that's putting the pressure on their emergency room physicians. And I'm sure it's affected. It affects what you order for lab work. I used to order complete chemistries, and every once in a while you'd find someone with a high iron content that you would never think of ordering, or somebody with hypothyroid, and you'd never pick it up clinically. I think it's affected.
More negatively than positively?
I think so.
Do you see any positive aspects that have come out of?
Pardon?
Do you see any positive aspects that have come out of the way medicine is moving now?
Well, the positive aspects along in education, I think, that the residency programs never used to have them. It was, I don't think there was 1936, there was a neurosurgeon this side of Boston. Now you don't have to hunt too far.
So do you think that, well, let me ask you, where would you like to see medicine go in the future?
Go back to as it was in 1936 with the addition of anesthesia and antibiotics.
How do you think the relationship between a physician and a patient has changed over the years?
I don't think it's changed too much. If you are interested in the patient and give them time to tell their story, and you feel that they feel that you're interested in them, they never forget it.
How about women in medicine? How has that changed since you first
Oh,
started practicing?
it's changed from
0?
4 to 0 in most medicals to 50, as you know, 60% the same in veterinary medicine. And I don't think as much in dental medicine. I'm not sure about that. But I don't know just when it started, but Priscilla White was an intern at Memorial Hospital. I think Memorial was at one time a women's hospital, and they had women interns. And Priscilla White became, I think, the first partner of Dr. Jocelyn in his diabetic office, which became the Jocelyn Clinic. And she was very well known. She took an interest in treating patients in pregnancy with diabetes, and she was really well famous for that. And Dr. Leahy, his first partner was a lady, and I think that she interned at Memorial. I'm not sure about that, but I think so.
How do you think Worcester or Holden is different from other places you practice? You know, you mentioned being in California with the Army. What do you think is unique about this area?
I don't have very much experience anywhere except when I was in California, it was different. I was in the service, and we were treating, you know, healthy people. I had to lean back from putting people into my car when I went to the service, and I threw after I got down in the desert, in the sand, I thought that had killed me, and it cured. Walking in the sand cured that sciatica. I sent my brace home, which I had hidden at the time of my physical exam, and I never had trouble. We didn't have to lift patients, and the guys that were lifting patients were a lot stronger than we were.
Have you felt that there's been competition between physicians?
Well, to some extent, but not as much as one would think. I don't think it's been obvious in my practice.
So, if you were to give advice for people graduating medical school now, what would you like them to know?
Well, I think that they just have to consider that you're lucky to be in the country where medicine is so well taught, and I think when it comes to picking what you're going to do, it's hard to say. I think everybody has their own. I don't know how you just pick that. I suppose during your medical education, you all of a sudden decide you want to be an obstetrician, or you want to sleep at night and do something else.
Yeah, you probably have a lot of experience with this. Are more babies born during the day or at night?
Well, it always seems at night, because that's when you get waked up.
That's what I've heard.
But I don't think too much different.
You don't think that they know to wait till 3 in the morning? Yeah, is there anything else that you'd like us to know about your life or your experiences?
No, I don't think so, except that when I started, house calls were $3 and office calls $2, because the economy was different. But I would like to mention one thing. When there were no teaching hospitals in Holland, in Worcester at that time, except St. Vincent's started to have residents from Georgetown, I believe. I think they were the first. I may be wrong, but I think, anyway, the welfare board in Holland and that area decided that they'd send all their welfare patients to St. Vincent's because they didn't have to pay the residents to take care of them. And we said nothing doing. We'd treat them for nothing. And they did. The surgeons did. We kept our own patients. We didn't want them to leave.
Well, thank you so much for your
Oh, you're